Good morning, all. Mike, how are you?
I'm good, Brock. How are you doing?
I'm good. I gotta go back and forth, try to connect. We're gonna click this. Good morning. Click that. And we are good to go. Let me call up my app so I can see the questions on there. Questions on there. All righty. Let me go comments. Okay. Still waiting for things to print. If I don't get to your question this week, I ran out of ink on my printer. If you sent me a question over email, I have a few of them, so I'll try to get to the ones that we can. Mike, we got some questions about cats that did not come through. That was the question about. I'll work on that while Mike is answering questions. So if you see me get up from the screen, it's because it's finally printing. Good morning, good morning, good morning, all. Mike, I'll start the show like I normally do. What is there anything that caught your eye this week in the animal kingdom?
And no, but I did get a couple emails that people had found me, and they asked which lilies were toxic to cats, and I didn't know the specific answers. I just consider all lilies toxic to cats. I know that's not true, but so I looked them up, and it's Easter lilies, tiger lilies, rubrum lilies, Japanese show lilies, and day lilies. Those are all extremely toxic to cats. And the reason I brought it up is because Easter time, springtime, we like to put flowers around the house. We sometimes give the gift of flowers to our loved ones. And if there's cats in the house, they like to chew on things, just to go over innocently and curiously go and chew on a stem. And just that action alone can end up in their death. It's very, very serious toxins in those lilies for cats. If you don't get treatment, they stated, and I don't know how they know this exactly, but they say if treatment is not initiated within 18 hours, then death is imminent, is certain. If we initiate treatment right away, the first thing we do is cause the cat to vomit. You'll have to take that cat to the veterinarian for that because you can't give hydrogen peroxide to a cat. Good luck with that. It wouldn't work anyways, most likely. The and then they had to be put on fluids, give activated charcoals, things we do for toxic ingestion to try to save them because it will cause vomiting, GI signs first, then the signs abate for a little bit while their kidneys are going into failure. And then the signs come back, and unfortunately, it's kidney failure at that point. So that's why I talk about it. And those were the specific lilies. Thanks for that question. I don't know all my lily species, so I just say avoid lilies. I know that's good advice. So
Yeah,
I
for all the married men whose wives have cats, just say you didn't get her flowers because they're toxic.
right.
That solves that issue
and,
right
and, and
there.
no chocolates because it's toxic. I'm going to get
Right. Yeah. You're just caring about the cat. That's all we're saying.
yeah. I'm going to
All
get
right.
blamed.
Well, then let's just get right to the questions. How about that? Um, uh, so I'm going to ask this question and then stop for about 20 minutes as Mike goes on. How can I get my greyhound into a stem cell study that he has bad knees?
So it's a great question. I just gave a talk Thursday night, 2 nights ago, here in Pittsburgh at the aviary, which was my first time down there. I'm embarrassed to say that. What a beautiful, beautiful aviary. If you haven't ever been and you're in the area, it's incredible. But to answer your question, there's no stem cell studies where you could enter them into. We're actually treating with stem cells. There's about I don't know how many vets around the country are using stem cells. Your vet could be doing this in a week, so you can ask them about it. But it literally is that easy, and it's within every veterinarian skill set. It's within every veterinary technician skill set to um, process these cells in house. It's a very simple, safe in house procedure. And if you were one of my patients, I would set up an appointment for an examination, see if we have a reasonable expectation that would help your greyhound. And then we would set up the appointment, and it's a 1-day outpatient procedure. Yesterday, I treated with stem cells. The animals were home by 12, I think, and I started at 7. So at the latest, they were home by 1. So if the owners picked them up, that was up to them. But it's an outpatient procedure. It does require general anesthesia to collect the fat. Most greyhounds I know are thin or not overweight. Some are, but most aren't. So we take it from their belly. So there's a little incision, about a 2-inch incision, just around their belly button in the umbilicus area, because there's a good source of fat right underneath that. And we collect that fat, close it up, and put a collar on them while they have an IV catheter in. While we're processing those cells, that takes about 2.5 hours in-house. As soon as those cells are ready, the techs notify me, and I inject both knees and whatever affected joints there are. And then we give some through slow intravenous administration with a hemofilter, which would block any fat particles from getting in. It just allows the good stuff in, the stem cells with all of the supporting cast. We call it stromal vascular fraction. And it's that simple. And that generally will help these animals within 3 weeks to 6 weeks. I tell people 60 days is when I expect all of them to have a response. In my experience, we've had some that don't respond that quickly, and we end up doing it again maybe a year and a half later if they need it. Am I still on, Brock?
Yeah, I'm trying to print stuff out, so I figured you were going.
Okay, sorry about that. It just went to a different screen, and I wasn't sure if I lost.
No, that's okay. Let me ask the questions I have in front of me. Then we'll start with that. Our almost 14-year-old Siamese cat, who is 15 pounds, is neurotic. All she wants to do is eat and drink. She also is constantly opening and closing cabinet doors, banging them. We have taken her to the vet, and they can find nothing wrong with her. Blood work normal. She behaves perfectly while at the vet. She howls at night. We love her, but she is so disruptive. The vet tried anxiety meds as well, but they didn't help. Is there anything? And then it's help with exclamation points.
Yeah. Did she say how old that cat was? I missed that.
14 years old.
14 years old. Okay. So sometimes when they get older, they do develop, they can get cognitive decline just like people can, just like dogs can, and they will start to get more anxious. Now, I start looking at things when I hear this. I love to hear that the blood work's excellent. Excuse me. I suppose that they took x-rays on an older cat. I'd recommend that just to look for something. We're looking to see that it's normal. Let's put it that way.
Right.
You'd be surprised sometimes what we see when we take an x-ray, even if they're not vomiting or having diarrhea. We found hearing aids in cats. We found batteries in cats, things that you would never expect a cat to eat. They've ingested. We've even taken out hairpins, not pins, the little ties that people put on their ponytail. And we've taken out, just recently, we probably took 30 of them out of one cat. So it's pretty amazing that some cats will ingest things. So sometimes it's worth just taking an x-ray to make sure there isn't something that could be seeping lead slowly or something of that nature, a battery, that kind of thing.
I don't know if if dogs have HIPAA laws, but did the owner not realize that she was missing 30 hair?
Yeah, I know. And so I know, but at any rate, and that cat had been seen by the emergency veterinarians, and it was just let go. So that was a coincidental finding that there was something in the stomach. Well, that something never moved out of the stomach, and it turned out to be a major cause of an obstruction. So it was and I'm not criticizing the emergency vet. They just saw it. They did see it. They didn't know, and they told the owners about it and said, keep an eye on it. Never moved. So at any rate, I know it's kind of odd. So cognitive decline. So I give a handout to owners with the different things I like to use for these anxious behaviors. And before we get to the Prozac. before we get to the antidepressants, and to see if we can naturally calm this down. Sometimes that doesn't work, but I also look, and I hope they check for high blood pressure. Some of these cats will start to go blind from high blood pressure, and they'll start to act differently. They can't see as well, and especially in the night. And cats are used to using their vision, of course, and the adaptation process when they're losing vision can be a while, and they can get very vocal. So I start thinking about those kinds of things. That doesn't mean that's what's going on, but we want to make sure that we dot every I and cross every T, because it's a 14-year-old cat, and see if those things are issues. We try these things on cats. Now, here's the other side. Some people will use CBD in these cats. I haven't been successful with that in cats, so I don't recommend it in cats. I just haven't been successful with it, but that doesn't mean it doesn't work. It's one of those things that you can try, and I'm talking about the CBD oil that is THC free. In Pennsylvania, the only kind you can have has 0.03% of the THC or less, which is the part that makes them high. So it won't make them high. It'll just hopefully help the stress, anxiety. It helps cancer. It helps pain from osteoarthritis, and it helps seizures. So it might be worth a try in your cat's instance. Speak to your veterinarian about that and see. But there are many what we call anxiolytic drugs that we can try, things that help to cut that anxiousness or anxiety. And it's not just Prozac. There are others that can be tried in cats, and safely. And I'm a bigger fan of those today than I was 10 years ago, because we know a lot more about them. But it's not my first resort. It's my last resort. And that's because you want to try the other things, the more common things first. And you want to try the natural sedatives first, if your cat will accept them. And there is a product called Feliway, Feliway. Don't ignore that, even in an older cat. They have diffusers you can plug into your wall. If you keep your cat in a room for the evening, you can plug it into a wall. I think it covers like 20 square feet. And you can read it on the instructions. I'm not positive about that. I think that's about what it is, because I've used them. Or if you can get it in a spray form, and you can spray some blankets in a place where your cat might want to sleep, and try that, because that's the mother's pheromone that she rubs when she rubs her cheek on you. But she puts that in the den, the queen of all these kittens. She puts it in the den, and that has a very, very calming factor on some of these cats. And that may help. It's a very simple, effective, and economic way to try to see if you can help calm your cat at night, especially when it's going crazy. The banging on the cupboards, those kinds of things. If there is some kind of cognitive decline, then we have to find out, is there something that's causing that decline, a tumor? You'd probably need a CAT scan or an MRI to determine that. I'd leave that to the radiologist to decide which one would be better. I think in the brain, it's an MRI, but that would be a step you'd have to take if you're willing to find out if there's anything going on in the brain. Otherwise, we just try to treat the symptoms. And I'm sorry, I can't give you more information than that, but those are the things that go through my mind. And that's what we try when we see these behaviors develop in animals suddenly, or even over a period of time as they get older.
I thought cats just open doors and because they're cats. I didn't know there was some kind of, because mine does the same thing.
Well, it's a good thing they don't have opposing thumbs, because they would control the household.
Mine would go in the fridge, open something, throw it on the ground, and walk away.
Yeah, open up the kennel. You don't want to feed me? I'm going to eat this.
Right. Okay. Well, let's stick with cats. My 11-year-old cat a few years ago was diagnosed with urinary crystals, which have required since a special diet. Prior, he ate caboodle and greenie treats for many years as an outdoor cat until we adopted him. We're experiencing supply chain issues. Who isn't obtaining to his food? Does he need to stay on the special food for the rest of his life? Or are they asking for trouble by switching his food when he's had crystals in the past?
That's a fantastic question. So I really
came up with it.
Yeah, I really appreciate that question because we're all having trouble during these supply chain issues. And we get calls at our clinic, doc, we can't find this food, this prescription diet. And obviously it's a serious concern because we don't want to cause problems. It's like years ago, they had this insulin called Vetsulin. It's back on the market, but it went off the market. We had so many dogs on Vetsulin as their treatment for diabetes, type 1 diabetes, where they needed insulin. They're insulin dependent. And Vetsulin went off the market. It got closed down by the FDA because they found crystals or something. And it took years to come back. Well, then we had to go and we had to try different insulin brands, which changes the whole treatment on all these poor dogs and these owners. And I remember the frustration for us vets, for the owners. I remember people being mad at me because Vetsulin went off the market, and I understood the anger, not with me, but I understood it. It was just a very frustrating time, especially when you spend a lot of time. So here you are with a diet, and who would have thought or thunk that we were going to ever have this problem with diets? So the crystals that they saw, the type of crystal is important. Is just, let's say it's a struvite crystal. That type of crystal, it has magnesium in it. That can dissolve in an acidic urine. So there are a lot of diets now, a lot of the name brand foods. If you feed that diet to your cat, it will acidify the urine because the companies realized that there were too many crystals forming. There was too much ash content, too much magnesium, and the mineral content in the foods, 5 times more than what they needed, up to 20 times more than what they needed. So that was back in the 90s. So now the major food companies said, all right, let's fix this. And they did. Otherwise, they were going to lose their brands off the market because nobody was going to buy it. The vets were just going to say, don't ever use this. And right. And so fortunately they did. So you can feed. And with cats, I strongly encourage you, if you can't get the diet and it's for urinary tract issues or stone formation, switch to a wet food only. And in that wet food, you can add warm water to it. You can speak to your veterinarian about this. We like to slowly wean them over. But Dr. Osborne was a urologist with the University of Minnesota for 45 years, I believe. It was 40 some years. And he's just the guru in that area for all of us veterinarians. He's very, very nice man. And when you call him, he would share all his wisdom with you if you asked and had time. Just a wonderful human being. And one time I was talking to him about my own cat that had blocked or obstructed with this urinary tract disease that male cats oftentimes can get into an emergency with. And I said, Doc, what have you come up with? Is there anything we can do to prevent these crystals? And he said, well, you want to get them to drink more water. And I laughed and I said, how do you get them to drink more water? He said, well, you can feed them wet food. Number one would be the easiest way, switch them over to wet food. And he told me this in the 90s. I was still in the ER, doing emergencies, seeing these cats 10 a week. You'd see this feline lower urinary tract disease where they get crystals that some of them would form like a sand in the bladder. We cause sludge, and then they would get inflammation of the bladder lining from this sludge. It's cystitis, and then they feel like they have to go to the bathroom because the wall of the bladder is thickened, and the pressure receptors that are there, when our bladder fills up, think of it like an inverted water balloon. When it fills up, those pressure receptors in the lining of the balloon get squeezed, and then we get that urge we have to urinate. We go to the bathroom, we feel better because it relieves that pressure. Well, when they get cystitis, it stays thick. Those pressure receptors aren't relieved, so they feel like they have to go all the time. So when they empty their bladder, they keep straining because they feel like they have to go, and they push this sludge into the urethra. And on a male, it's like a funnel. It goes down narrow, and it can block and obstruct them. The females, it's a wider opening. They don't usually obstruct. So we want to keep them on a liquid diet. We want to make sure they're getting more water. And Dr. Osborne told me that a long time ago. It was golden advice. It still is today. All my cats are on wet food now. I used to have them all on dry food because we didn't know this stuff. I think most of us just fed our cats dry food, a good quality dry food. But now I don't have problems with urologic syndrome in my cats, at least. I haven't for 15 years because I switched them all over to wet food. And you can add warm water to that as you mix it up, and they get used to more and more. So you get those little cans of Fancy Feast. I feed Fancy Feast to my cats. If you fill it with 2 cans of water, that's quite a bit of water. And warm water, mix it in. My cats lap every drop. They clean the bowl. And I do that twice a day. They love it. So that helps dilute the urine. So it helps these this sandy stuff or crystals to flush out in the urine because they're getting plenty of water. And then the other thing is that that acidic urine, these do promote acidic urine, will help to dissolve some of those crystals. Now, there are some crystals, and this owner may be screaming at the picture right now saying, but my cat has the other crystals that don't dissolve in an acidic urine. And yes, that is a problem too. Well, a wet diet will help that just because it keeps them flushing, and it will help promote quick elimination of those crystals before they have a chance to hopefully precipitate into stones and block your cat. The diets are best for that. When you have the stone that forms, oxalate stones we call them, that form in an alkaline urine, then the diets help to keep them in solution until they're eliminated. And those diets are very, very effective at that. So, but this is a good thing that you can do if you can't get the diets anymore, if you can't get them for a while. You have to have something. So just remember that. And switching them over, you want to do it gradually, but say you're out of the food and you just found out you can't get it, you just made a mistake. I mean, it happens. We all do it. And you have to switch over. Well, then you can get a probiotic like Fortiflora from Purina, or speak to your veterinarian. IAMS makes one called ProViable that there are a lot of studies on. And those studies show that the bacteria that are in those packets that we sprinkle on their food, the good bacteria, are specific for cats. When you give them the feline Fortiflora, well, you can sprinkle that on their food as you change them over. And a lot of times you won't even see the soft stools. If you can't, then you just start feeding them the new diet and understand that they're probably going to get gas and because of the change in diet until their microbiome or the bacteria figure out the new diet. And it might take a week, 10 days, and you may need some help from your veterinarian anyway. So a lot of times I do recommend you get that Fortiflora and sprinkle it on the food as you change the diet. Long-winded answer, but that'll help a lot of people. The number one reason, well, second to vaccines, the number one reason people go into their veterinarian is for feline lower urinary tract disease, these problems with crystals in the urine. And it all stems from that. Females get it and males get it, but the females don't usually end up in the emergency clinic because they have that wider urethra. I've seen maybe 3 in my career, 3 females that block. But males, I mean, almost weekly, I hate to say it. We try to educate cat owners in our practice on this information, even from kittenhood, to try to get them on the proper diet so that they don't form these stones, or if they do, they keep flushing them out and or keep dissolving them. So it's a big, big help. And Dr. Osborne's wisdom, and you get a few cats that won't eat wet food, they'll only eat dry food. And the other way to get them to drink more is to take spring tuna water, maybe a tablespoon of that, and put it into their water bowl, or you can even make ice cubes with it and put that into the water bowl. And that was a great suggestion Dr. Osborne came up with and shared with me long ago, over 30 years ago, and is still golden advice today. I thank him every day in my prayers for sharing that information because it's helped so many animals.
Okay. So my cat started Dr. Mike's meal plan this week. Just to be sure, is it a quarter cup food, dry food mixed with a half a can of wet food twice a day?
So no and yes. So it's a quarter cup of dry food in the morning only. They only get the dry food in the morning, a level quarter cup of the dry food in the morning, and then 2 heaping tablespoons, which is about a half a can of the small cans, like the Fancy Feast cans, a half a can morning and night. Add water to it because your cat's going to be hungry. We call that the Catkins diet. And your cat will lose weight over the next 4 months. And the ideal weight for most cats is between 8 and 10 pounds average. Now, of course, if you have a Maine Coon, it might be 20 pounds to be thin. So I understand there's variations, but most cats, the average weight is 8 to 10 pounds. For I should say for the females. Some females are 6 pounds. They're smaller. I have one that is at their ideal weight, but most of them between 8 and 10 pounds. The males might go a little bit heavier, 10 to 12 pounds. And so that diet will get them to that ideal weight. It's very, very effective. If you have a very large cat that says 25 pounds, they're going to drive you nuts on this diet because it's going to be, they're going to constantly be hungry. So if you're going to
they'll be hangry.
Right, hangry. If you're going to cheat at all, give them the canned food a little more, maybe 3/4 of a can twice a day of the canned food until their weight gets down, then wean it down to the to half a can. And you will get them down to the weight. We don't want to do it quickly. We don't want to starve them. Cats have a bugaboo. If you starve them, they can go into a condition that we call hepatic lipidosis, which means the liver has fat in it. It starts to metabolize, and you'd think that would be a good thing, but it produces chemicals that cause the cats to become anorexic, and you cannot get them to eat. We actually have to place tubes, feeding tubes in them for about a month to get them to eat again. When I was a young veterinarian, we thought that condition was fatal. And we thought it was just a fatal condition that you couldn't cure it. And then one chiropractor in my practice loved his cat, like we all do. And I said, Doc, can't you put a feeding tube in? I'll feed him. I'll do anything for him. And after about 30 days, we could pull that feeding tube out. And then I found out other vets around the country were finding out the same thing. So now we know we can put a feeding tube in, but who wants to do that? And it's a nightmare. So we don't starve them. If you starve them, they can go into hepatic lipidosis. So we do it over time, and that Katkins diet works very well. So to recap, a level quarter cup of dry food, if you're feeding dry food, a level quarter cup of dry food in the morning, and then also in the morning, a half a can of Fancy Feast, and mix it with some warm water. If you want to mix it with the dry food, I don't care. If they don't eat that dry food by noon, you pull it up. They don't get it till tomorrow. And my cats inhaled everything. They had no problems. Early on, I did that. Other people can just put them on wet food only. So you can speak to your veterinarian, but most cats don't need a can of Fancy Feast twice a day. They need maybe 3/4 of a can twice a day, and that's more than enough. So added with water, that's more than enough to get them to their ideal weight. Yeah, they'll be hungry, but we control what they eat, I hope, unless they do develop opposing thumbs. But we do control what they eat. So we want to make sure that they're in an ideal body condition. And that is very, very healthy for longevity. A lot of those cats at that ideal weight live routinely 16 to 18 or longer. And I have them in my practice, and they look fantastic. And I have an almost 18-year-old cat. I thought she was 16 years old, and she still looks good. And it's, her eyes are getting, the vision's going a little bit. Her hearing is not going, but she still looks good. She looks sleek. It's not the one on the couch behind me. She is 18. But there is another one that looks like a young cat, and she's the same age, almost the same age. She's, I think, 6 months younger. I always forget. I always say my animals are younger than they are, so I don't like to admit they're getting older.
Okay, like this is actually a good question. This is I think is a good question. Can my dog get Lyme after having been vaccinated for it? Someone told me not to waste my money because their dog got it after he was vaccinated.
Horrible advice, in my opinion.
I was thinking the same thing.
Yeah, horrible. So how does the vaccine work? And Lyme. So we have a safe vaccine available for dogs for Lyme disease. And how does that work? And can they get Lyme disease with that shot? No shot's 100%. So could a dog get rabies with rabies shots? I sure hope not, but none of those shots are 100%. In the studies, it protected 100% of the dogs. The rabies vaccine protected 100% of the dogs when they were challenged. So say it's a 3-year vaccine. To get the label for 3 years, they had to challenge dogs at 39 months after the vaccine. So they gave a buffer of 3 months longer, and they had to challenge them with hot strain rabies, and they had to 100% be protected to get a 3-year label on the vaccine. That's pretty stringent, and I like that it's like that because rabies kills. So, but I still don't say that's 100% vaccine. Lyme, we call it an A-rated vaccine, meaning that it's at least 90% protective. And so would you want that in your dog for blanket protection if the vaccine is safe? Of course you would. I would. I do. I have it in my dogs. And I don't want to over-vaccinate. But so the vaccine that I use is a specific brand. Your vet may disagree with this, but I would challenge them to the literature. I guess that's the only thing you can do is go to the literature, and it supports what I'm saying to you. The outer surface, think of the bacteria that causes Lyme disease. It's called Borrelia. It's a spirochete from the deer tick. The deer tick gets it in its mid-gut. And this spirochete, this bacteria, and they call it a spirochete because it's spiral shaped. But let's pretend it's round for this example. On the surface of that spirochete, of that bacteria, there's outer surface proteins. I call them Mickey Mouse ears. just so you can get a picture in your mind if you're just listening. Well, one of those Mickey Mouse ears is called outer surface protein A, OSPA, OSPA, outer surface protein A. Muriel or Boehringer Ingelheim, they made in their studies, they made an antibody to that outer surface protein. They didn't make it to the whole bacteria. We call that a whole bacterin Lyme vaccine. We used those in the late 90s, and we found that there were a lot of reactions to that because there were proteins on that bacterin that mimicked things in our bodies that were very similar. So when they made antibodies towards that whole bacterin, it was in some cases making antibodies to normal things inside the dog and people when they tried it in people. So they had horrible reactions, and a lot of us didn't want to use it anymore. We didn't. And there were people that still wanted it, believe it or not. And it was FDA approved, but us vets really didn't want to give it. So their sales were declining. So they had to come up with better technology, and they did. So now we have the recombinant technology where they came out with this outer surface protein A antibody where they make it just to that. So now why is that important? Well, that outer surface protein A is what the spirochete, the bacteria, uses to attach to the midgut of the tick. So that protein attaches to the midgut of the tick. So now what causes that to release? They get a warm blood meal from the person, the deer, the mouse, the rabbit, or the dog or the cat. And when the dog is vaccinated for that outer surface protein A, they develop antibodies to it. And so it's anti-outer surface protein A. Now, when that blood goes into the tick, guess what happens? It destroys that spirochete and its ability to detach properly inside the tick, and it doesn't get into the dog. So that's how that Lyme vaccine works. I would rather my dog has circulating antibodies to outer surface protein A than not. Now, of course, NexGard is FDA approved for the prevention of Lyme disease. Either one of them are good protection. I like them both. If you live in tick country, it's most of the country. It's not just Western Pennsylvania. If you live in tick country, they're disease-carrying experts. It's not just Lyme disease, babesiosis, Rocky Mountain spotted fever, deer tick virus, ehrlichiosis, anaplasmosis. I could name a whole bunch of things that they carry that we don't want our dogs to get and we don't want to get. So NexGard kills the ticks. So it covers all those diseases. It's a blanket protection to get rid of ticks or to kill the ticks after they bite the dog. The Lyme vaccine gives protection specifically for Lyme disease. So you have this blanket protection. I use the Lyme vaccine in my dogs and NexGard in my dogs. So I have the best blanket protection I can give to my dog. And when I go out into the woods, I spray them with a Listerine. 90% Listerine up to the neck of the bottle and 10% water. And I spray it over their coat and I spray it over my clothes, and that helps repel ticks. So it's all of these things that we're using to try to minimize the risk of our dogs getting bitten by the ticks. But if they do get bitten, then they're going to die because they have the NexGard. And so that's why I recommend the Lyme vaccine. Now, here's the other thing. Can your dog get Lyme disease being on NexGard and being vaccinated with Lyme disease? Of course they can. Like I said, nothing's 100%, but I think that's the best protection we can do to prevent it. And if they get it, here's the good news. If they get it and you're following your veterinarian's advice, and this is specific, your dog is tested for Lyme disease. It's an annual test that we do. Most veterinarians use what's called the 4DX test, 4DX. It's a simple 10-minute test. It's 4 diagnoses. That's why they call it 4DX. A diagnosis for heartworm disease. And so you're checking to make sure your dog doesn't have heartworm disease. And then it does 3 of the most common tick-borne diseases, at least around us. It's Lyme disease, everybody's heard of that, anaplasmosis, and ehrlichiosis, which are other tick-borne diseases. And if you have a negative Lyme test on that 4DX test, and you vaccinate your dog for Lyme disease only, and don't use NexGard, you just vaccinate them, and your dog gets Lyme disease, your veterinarian can submit that to the company, and they will pay for your expenses for treating that Lyme disease, I think up to like $500, which is more than enough to cover the treatment for Lyme disease, in most cases. The NexGard, if you're using NexGard on your dog year-round and you can show receipts, or your veterinarian can show that you have purchased that from your veterinarian and you are giving it to your dog monthly and your dog gets Lyme disease, they'll cover up to $5,000 of expenses. Why would they do that? You don't need $5,000 to treat Lyme disease, but I like that they do it. Why do they do that? because, and it's the same company, BI. The reason they do that is they want to see if there is resistance to the two of those. Those are the dog's blood that they want to study. That's why they will pay to have those dogs treated and to analyze their blood. And every owner that has had that, I've had maybe 3 in the last year, literally in our practice. We have a big practice. We've had maybe 3 dogs that came back Lyme positive that fit those criteria, where the owners were doing everything that I do. If my dog's got Lyme disease, I could submit it as well. And I check them every year. And if they're limping, we check them twice a year or 3 times a year, just to make sure it's not Lyme disease. But it's a very good insurance policy, if you will, for your dog. And the vaccine, the outer surface protein A vaccine that we use from BI, is incredibly safe. It's non-adjuvanted, so they're not adding anything to it to stimulate the immune system. And so it works very, very well. It's a recombinant technology, which I love, because they're much, much safer. And we don't see reactions to it. Could we? Yeah, we could see it to an injection of sterile saline. You could see a needle reaction to it. And we might get some needle reactions, but we haven't been seeing many reactions to that vaccine at all. I can't count any, but I haven't polled my associates. And usually when we have reactions in our practice, we all know about it. You know, we all talk about it because we want to talk about it. We want to make sure that that lot's turned in, that we turn in everything properly to report that vaccine reaction, that adverse reaction. We want to make sure it's on our records, it's on our computers, that that dog had an allergic reaction, and so that we avoid it in the future. But it's a very rare event with that outer surface protein A technology. There are other vaccines out there that have outer surface protein A and outer surface protein C that they say are better. I would challenge any colleague to the literature. When I go to the conventions and the experts are speaking, the experts on Lyme disease are speaking, and I get up and question them, they can't give you any more information than I'm giving you about these vaccines. So the conclusion is more is not necessarily better. Having these outer surface protein Cs and all of this, they say, well, that's on the Lyme disease when it's in the dog. Or if that's the case and that were true, then we could treat the dog for Lyme disease with that vaccine, and we cannot. So I consider that not necessary. I'm not saying it hurts the dog, it's just not necessary. And that's why I like the outer surface protein A. And the literature so far supports exactly what I'm sharing here. And I attend a lot of lectures on this because Lyme disease is endemic in our area, and I want to make sure I'm current on it. And things may change in the future, but when we do these weekly podcasts or these live sessions, I can certainly update you. But nothing has changed in quite a while, and it's incredibly safe. So to that person that said it's a waste of money, I just gave you all the reasons why it's not a waste of money. It is blanket protection. And I do recommend it for your dogs if you're in an endemic area. In our area, we consider Lyme vaccine a core vaccine for dogs. In California, they probably do not. So, and I probably would not if they didn't have a problem with Lyme disease. I don't know. I'm not in California. Right. You have to speak to your veterinarian about that. But so I believe in core vaccines. What's common in your area? What does the veterinarian consider as important in your area? And I do not like to over-vaccinate dogs. But Lyme vaccine in dogs in our area is a core vaccine. There's not a vaccine for cats. Their body seems to take care of infections with Lyme disease. Once in a while, it can get through and they can get Lyme disease, but it's rare in cats. It's very, very common in dogs, people, horses. So we have to try to protect them.
Let me ask you a question off of that. So you said if your dog's limping, you check them more often. Are there like 2 or 3 good indications of if your dog has Lyme disease? Like the 2 or 3 biggest ones?
There are. If your dog has clinical Lyme disease, that means it's showing signs. 90% of them don't show signs, and that's not a bad thing. So 10% of them show signs. So if my dog could all of a sudden come up lame, and he could do shifting leg lameness. He's lame on his right front today. Tomorrow he's light on his other leg or his back leg. And you're like, what in the heck? Swelling in the joints and fever. When they get acute Lyme disease, they crash. 105 temperatures, sometimes 106. Their joints are painful. They're crying when you go to move them. Everybody's going to take that dog to the veterinarian. So
when you say a dog has a fever, Is
Right.
that dry nose? Or
Yeah.
like,
Hey,
how do you tell if a dog has a fever other
oh,
than
what
a
a great question. I'm glad you have animals, Brock. And
I'm
so
wondering, like, am I gonna have to stick it up the because he's not gonna like that either.
everybody that has animals needs to have a digital thermometer, a current digital thermometer in their first aid kit.
Okay.
And because when you tell me my cat's ears are warm or my dog's ears are warm or his nose is dry or his nose is wet and it's never wet or whatever, that is not reliable for us. We need to have that temperature. That's why we take a temperature on every animal that comes in the hospital because nothing's reliable. Granted, I touch a lot of animals every week. When I feel an animal, sometimes I can feel that they're warm. I just say, well, this is abnormally warm, but then the temperature verifies that. But sometimes an animal feels warm. Have you ever seen the hairless cats? And they feel warm all the time. They have a different thermal regulation center. They always feel warm. You take their temperature, it's perfectly normal. So feeling them being warm is not an indication they have a fever, and that's very important. Their ears being warm is not an indication that may be a cooling down process. It's not an indication that they have a fever. The only indication is their temperature is higher than 102. So 100 to 102 is normal in cats and dogs. And if it's 103, 104, you need to call your veterinarian at home. When we bring them into the clinic and the dogs are all excited and they're all happy and they're happy they're in the car and their temperature is 103, we're asking questions. Is your dog eating and drinking normal? Is everything normal at home? Oh, yeah, he's playing all the time. That's just excitement. That's a fever from excitement. We will ignore that with questions. We'll ignore that. And you can see what's normal for dogs when they come into our clinic. When a dog comes in, that same dog comes in and he's got 104 and a half, we don't give that to excitement. We say, all right, this dog has a fever and we need to attend to it no matter how he's acting. And we need to find out why. But so that's a great question. We should all have a thermometer on hand, a little drop of vegetable oil onto that tip of that thermometer. Somebody, can hold your cat in a towel, wrap it up in a towel, and you can check the temperature, or you can just take it to your vet if they're not doing right, and we can check it for you. But it's not reliable to touch your ears. I do have owners that always know when their animal has a fever without taking a temperature, and they're right when they come in. But that's unique. It's not the norm. Most people, when they think their animal has a fever, they come in, their temperature is perfectly normal, and that's the truth. And I'm happy about that because we don't want them to have a fever. But some owners are really keen. They go, no, I know my animal has a fever, and I'm not taking the temperature. You can do that. And,
So
and then,
I'm gonna be a little selfish here
all right.
and follow up with that. Is there something out there if your dog does have a fever that maybe I can't get to the vet today? Is there something holistic or something I can give them, put them in cooling pads or to bring the fever down?
Well, it depends what that fever is. If it's overheated, if you find it in a car and it's overheated, I hope the Lord that doesn't happen. That's a nightmare. But it's most fevers, if they're not panting and really distressed, you don't need to lower them. You can put coolness on their extremities. You can put a damp, cool towel around their neck. And but remember, they don't sweat like we do. They exhale. They pant to cool down. Dogs, I'm talking about. They pant to cool down. Cats will too, but cats have a different they have a similar thermal regulatory mechanism, but they don't pant like dogs, and they can. But when dogs get really heated, they can start panting. Now, there's a difference when a dog has 105 temperature or fever and is not panting, is just depressed, and a dog that has 105 fever that is overheated. He's been running around outside and it's too hot out and he's frothing up with thick saliva. That dog is overheated. The dog that's not panting has a fever. That's a brain issue. That's a thermal regulatory and the hypothalamus of the brain issue going on. And we need to attend to that to lower that temperature. Can we lower it by cooling them down? Yes, but I'm not sure that I would always recommend a patient with 105 fever automatically gets put in the bath, the cold water bath, because if they're not panting, they're not distressed. Maybe we can do it medically. And to bring it down, like in people, we use antipyretics, things that bring temperature down, and they can work very quickly in animals. Fluids can work very quickly to bring temperature down. We want to find out why they have that fever. And the dog that's chasing the ball, we know why they have the fever.
Right.
And they're running around, they can't cool down quick enough, and they're in trouble. And you better get the garden hose on them and wet them down, and then put cool towels on their extremities. their pads. People say, oh, I can put alcohol in their pads in their ears. Did you ever smell alcohol? And dogs don't like it. Their smell is way better than ours. Will it work? Of course it'll work, but I don't know that that's great advice. Just use cool water. And then if a dog's overheated, the most you want to bring that temperature down to is 103. So, Dr. Mike, that's still a fever, yes. But we have shown, I used to be an ER doc for 7.5 years, and this was published. You can bring a dog down to normal temperature with cold water baths and ice baths and things like that. And then you take them out of that, and guess what happens? Their temperature keeps plummeting, and it can still go down further. You don't need to do that. You take them down to 103 and you stop. And so you just cool them down. That's the whole purpose. Call your veterinarian. So what if your dog's 105, you took his temperature, you can't get to the vets, but you can always pick up a phone. You can call your vet, you can call the emergency clinic and see, look, I can't get to the vets. Is there anything that I can give to my pet or anything that I can do to help them until I can get to the vets? And then I'm sure your veterinarian would give you direct advice. And it might consider something like aspirin if that's all you have on hand with directions. I'm not going to recommend everybody give aspirin. I know some vets, some colleagues out there will tell you that's poison to the dog. That's not true, but or I'd never recommend it. I know some vets would tell you to give Tylenol to your dog. I consider that poison to your dog. So you get differences with veterinarians. And there, I could give you all the rationale why I do and why they use Tylenol to do all the liver studies and rats. They destroy their liver with Tylenol, and then they study how they can help the liver. And that should tell you something, because the same thing can happen in us and our dogs, and it can cause aplastic anemia in our dogs, which is an anemia, a decrease in red blood cells, a destruction of red blood cells that aren't coming back. So I don't like Tylenol, and it takes you 30 days to figure out if it's happening. And then, I had one guy call me and said, my vet said it's Rate and Plums, which is our formulary that a lot of veterinarians use in the country. It's updated, almost, because it's online now, it's updated almost monthly. If anything changes, they can do dynamic updates. And Tylenol, there's a dose for dogs. Yes, there is, but look at the toxicity level of Tylenol. Look at what it can happen when you have an adverse event. Aplastic anemia, can I help that? Nope, I can't help that. So why would I give the dog Tylenol? I don't want to give it something I can't help. And if something does go wrong, maybe it's a small fraction of dogs that it hurts, but that's why I wouldn't give it. But another vet might prescribe it routinely. So that's why you should ask your veterinarian directly, and they can give you some advice in that situation. Did I answer the original question? We got off on a tangent.
Yes.
Okay, good.
Okay. So we have a kitten around 6 months old. She was a stray that has had reoccurring respiratory infections. She's had 2 rounds of antibiotics, which helped, but now several months later, she has a rattle in her chest and sneezes daily. She's an indoor cat without any contact to any other cats.
So that's a cat, and we've talked about this before, but you may not have been on, and there's always new listeners that will appreciate this. Cats can contract. So when we vaccinate them. Everybody says they're distemper vaccine. Well, really, we're vaccinating them for 3 viruses. One of them causes distemper, and true distemper in cats is a condition called feline panleukopenia. Pan means widespread. Leukopenia means the white blood cells are depleted. So if the normal white blood cell count, I'll just give you an example, when a cat is 5,000 to 17,000 per microliter of blood, they're down at 100, or they're down at 1,000. That's feline distemper. That's what feline distemper causes. So obviously their defense is down, and they can die from secondary pneumonia very easily because their immune system is not up to par. So they need support when they have panleukopenia. So that's one of the 3 viruses that we vaccinate them for. It's called FVRCP. FVRCP. Feline viral rhinotracheitis is herpes virus in cats. It's not contagious to us, thankfully, and it causes upper respiratory infections, like you're seeing in your cat: sneezing, coughing, runny eyes, and it can descend into secondary pneumonia. So I'll get to that in a minute. But mostly it's an upper respiratory infection. And if they got it before the first vaccine, or the queen or the mother of that kitten was never vaccinated, they may not have ever gotten passive immunity in the mother's first milk, called colostrum. And so now they're susceptible to feline herpes. And that's everywhere. Out in the environment, it's everywhere. So your kitten picked it up, it got vaccinated, but it wasn't in time to prevent a chronic infection from seeding. Now the vaccine helps prevent future infections, but it didn't catch that initial infection. And so your cat is already seeded with herpes, possibly. Then the other one is FVRC, calicivirus, and P is the panleukopenia, the distemper. Calicivirus is another virus that causes upper respiratory infection in cats. It's a little more aggressive. It can cause ulcers on the tongue, ulcers on the eyes, and it can cause runny eyes and upper respiratory signs. So most of these cats that have chronic sneezing are cats that have chronic herpes. So what can we do? Ask your veterinarian about lysine. I mean, I can tell you about it. Lysine is an amino acid. It's very safe for cats. It's a very simple building block of protein that's incredibly safe in cats. But in the food, it's not in high quantity, so we can supplement it. We can give to a cat that's actively sneezing 500 milligrams of lysine twice a day. And then when they're not sneezing as much, you can go down to once a day and just keep them on it. And it will help decrease the replication of herpes virus in your cat. And yes, it's probably a chronic infection. Now, the rattle, I don't like. As I said, most of these are upper respiratory infections. We give the antibiotics to prevent secondary infection, or if we suspect they have a secondary infection, it does help them to get it over sooner by getting rid of the opportunistic bacteria that like to cause pneumonia. And you've heard of Bordetella and things like that. They can cause pneumonia in cats and dogs and people. So the antibiotics will help destroy those or kill those, so that your cat immune system can get over that herpes virus quicker. And that's why you said the antibiotics helped, and a lot of us will prescribe them for that. But when I hear a rattle, I get a little concerned that he may be developing pneumonia, and you might want to have your vet take a listen again to make sure that it isn't true congestion in the chest, that it's not descended into the lower respiratory tract where they can get into very serious danger, that it's still in the throat. Sometimes people will hear a rattle at home, they'll bring it in. I don't hear any congestion. I don't hear any wheezing at all or crackles in the chest, but I do hear it in the throat region, which means it's still upper respiratory. So you have to have your vet check that to see, and they may want to prescribe an antibiotic if they do think that is going into the chest, because that's where they can get into trouble, and that's where I recommend you help them. But that the lysine can be bought in a gel form, a capsule form that you can sprinkle on their food. They have different flavored. We sell it at our clinic. I think most vets sell it because it does decrease the proliferation of that herpes virus. Probably every veterinary hospital has technicians that have adopted cats with chronic herpes virus, and we have them on lysine. So it's very, very common to help with that condition. It doesn't cure it, but it certainly does help. And since this will probably be a lifelong issue, it's a good idea to have on hand. There are other things that can cause that noise. They can get polyps in the back of the throat, in the larynx area, and their sinuses that can cause these chronic upper respiratory infections. But that's something that your veterinarian should pick up on over time. Sometimes you don't pick up on it the first time, but when it's not going away or it's getting worse, we then start doing more tests and then we find it. So there are other things that can cause that, but in general, I just gave you the information that is most common.
Okay, and this Charlotte has a great question, and we actually didn't cover it with the question about fevers in dogs. What's the normal temperature for a dog or cat?
100 to 102. And 100 to 102 degrees, not 100.2, 102 degrees. They run hotter than we do.
So for both dogs and cats?
Dogs and cats. We run at what, 98.6 on average. Some people are a little bit cooler. Some people are a little bit warmer. They're at 99. But in animals, they generally fall, dogs and cats fall between 100 and 102. And if your cat was 102.5, I'm not alarmed.
Okay.
I'm not alarmed, but if it stays up there or goes up to 103, then you should call your veterinarian. I do not routinely temp my animals. I don't do it at all unless I think they have a fever. Unless I think they're sick, then the first thing I do is take their temperature, see if they have a fever, because it gives me clues. It gives me information. Fever can be a result of many things, but if they have a fever, then I take it more seriously than them just being off for a day. It's like every dog and cat that comes in the clinic, unless they turn into a raving lunatic, we take their temperatures, and that's for a reason. Now, if you ask me about the ear thermometers, I thought you were going to ask me about that because it's a lot easier to do. They're just not that accurate in dogs and cats. They have a much deeper canal. Excuse me. Sorry. They have a much deeper canal than we do. They have a vertical canal that goes down and a horizontal canal that goes across to their eardrum. It's much deeper than ours, and I just those aren't the temporal thermometers. Just aren't that accurate on dogs and cats in my experience. They may have come out with a newer one for hundreds of dollars that work, but that's not what you're going to have in your first aid kit.
All right, we got another question here. We got what, 5 minutes left? A little 5 minutes.
Wow, this hour blows by.
It really does. My almost 10-year-old golden retriever is showing signs of arthritis in her front legs. We give fish oils and glucosamine.
I love it.
What is the next step to help her?
When you tell me the front legs, I think elbows first, elbow dysplasia, because we see it. So the elbows get an advanced degeneration. I don't know how old. Did she say how old that golden was?
I was 10 years old.
Okay, so it's getting older. So they get degeneration in their elbows, arthritis. That's one of the areas. Their shoulders. A lot of people think it's their shoulders. It's actually more common in their elbows and their wrists than it is in their shoulders. But we do see it in their shoulders too. So for me, for your veterinarian, I call it the A list. So you're doing glucosamine, you're doing omega-3 fatty acids. I love that you know about that. It does reduce inflammation. Adequan is a nutraceutical. If we don't think the glucosamine chondroitin sulfate, which would be Dasaquin or Cosequin or Glycoflex, those are ones that have been studied. Those will help lubricate the joint. If that's not working, we'll sometimes step it up to Adequan, which are injections, which we can teach owners to give at home. Yes, you can do it, and it's safe and it's very helpful in a lot of dogs. That would be in part of my A list. There's class 4 laser therapies. There's sound therapies now that can be tried to see if it gives them relief for a period of time. There's acupuncture that can be done. And there's non-steroidal anti-inflammatory drugs that can be dispensed. And my gold therapy are stem cells from their fat back into their joints. Are the number one treatment. I've done 2,000 plus. The number one treatment for the stem cells that we use from fat is osteoarthritis. And the reason is because the fat is in the same germ layer as the joints are. So when we take the repair cells out of that fat and put them into the joints, concentrated in that local environment that's damaged, that environment is sending out distressor signals. That's what the body does. And we put those stem cells in, and they secrete a whole bunch of factors, a lot of factors that communicate with those distressor signals and fix it or try to fix it. And 26 out of 27 studies that have been evaluated in animal arthritis models showed that the adipose-derived stem cells given into the joints are causing cartilage regeneration, which we believe is a good thing, but they also reduce inflammation. They modulate the immune system, so the immune system still doesn't keep causing inflammation, like you've heard of rheumatoid arthritis. Well, in arthritis, we think that the immune system is attacking some of the rough surfaces when that cartilage is deteriorated on the joints. That cartilage is that slippery, shiny surface on the joint bone that you've seen on chicken bones. That's the cartilage. And when that gets destroyed, the immune system gets involved. Well, the stem cells modulate that immune system and they reduce inflammation, therefore reducing pain, hopefully regrow new cartilage. But in all cases, we hope they're increasing flexibility and range of motion, which is a good thing. We did 4 of us veterinarians across the country. I was one of them. 155 dogs, ages 1 to 17, with pain from osteoarthritis, diagnosed pain from osteoarthritis, were treated. No statistical difference in the response. Over 95% of those dogs improved on all 3 of those scores. Pain scores, range of motion, and flexibility. That means they can get up and down steps, in and out of the car, up and off the furniture. They can go to the bathroom in one spot. They're taking longer steps, which means range of motion. They're feeling better. And they look younger because they feel better. Their eyes get wider because they're in less pain. So that's my gold therapy, and that's a discussion. I look at every case as an individual, and everybody asks me if their dog would qualify. Your dog might have issues that I don't know about that would not make it a good candidate for stem cells. That's why I would have to see it, or a vet that's trained in stem cell therapy would have to see it. And then I make a decision, is there a reasonable expectation that your dog would get better? And if there is, I offer that treatment. I love that treatment. It's expensive, but it's wonderful. It's an incredible, I wish it wasn't expensive, but
Right.
I offer it and let the owners decide because it's incredible. And remember what I said, 1 to 17, no statistical difference. We do know when stem cells get older, they get less potent. We know that they get less in numbers. But if I take a cup of cell from a cup of fat from an 8-month-old dog, there's over 1 billion stem cells in that cup of fat. I'll just say 3 tablespoons. There's over 1 billion stem cells in most 8-month-old dogs, and they're fat, and they're very, very powerful. They're potent. If I take that same dog when it's 10, like your dog, and I take 3 tablespoons out, there may not be 1 billion, there might be 300 million, but I need at least 10 million in each joint to help that dog with a therapeutic dose. I prefer 25 to 35 million. Well, I have them when there's 300 million. So it's incredible that first generation stem cells are present even in older dogs in enough quantity. Now they're less powerful than that younger dogs, but that doesn't mean they don't work. Obviously it does, because we saw no statistical difference among those ages. And that was a clinical trial that was done with veterinarians, and we're all clinicians. What we care about, is there a clinical response? Is your dog better? Do you see it? And does your dog feel it? And do we see it? All 3 of us have to win on this, or I wouldn't do it. And so it's that win-win-win. And that's why I'm so passionate about that. And I go around the world talking about stem cells for that reason. I'll never shut up about them because of what I've been had the pleasure of seeing. When I was showing the videos to this group of people that were lay people Thursday night, when I was showing the before and after videos to these people, they were just wowed. You know, seeing a 2-year-old dog with immune-mediated polyarthritis, all the joints were painful. A 2-year-old dog, a pit bull, that's walking like an old man and just couldn't, barely take a step on the floor. 2 months after stem cell therapy, it's running in the field. That is something that doesn't go away. It's not a Band-Aid. A year later, that dog's still going to be running in the field, in my experience. If it's not, we froze cells, cryopreserved them for the future. We don't have to do surgery again. We can call them back and retreat that dog, and that's a wonderful thing. So it's when you show that to owners over and over and over, I have 300 videos like that. So it's and I just pick different ones. Each time I go, I show different ones, or I show dramatic ones because I like to show them. And even veterinarians just sit there and get wowed if they haven't seen it. So we all like seeing our dogs out of pain. So that's a long-winded answer, but I'm passionate about stem cells. That is the gold therapy as far as I'm concerned for pain from osteoarthritis. So that is an option that you have. If your veterinarian doesn't do it, I don't know how to tell people to do this, but if you go to ardentanimalhealth.com, ARDENT, that's the technology I use. I'm going to plug that simply because that's who I'm the spokesperson for, on a handshake. If a better technology comes out, I'm gone. I took an oath for that dog, not for that company. I say that every time I'm speaking, but I don't think any company is going to come out with a better technology because they've came up with a technology that wrings out 90+% of those stem cells that are in a gram of fat. I don't think another company is going to spend millions of dollars to try to come up with 95%. I don't think we need 95% of the cells. So it's that's why I'm happy to refer you to that. Again, it's Ardent, ARDENT, animalhealth.com. And they have videos on these animals. They explain the technology. And there's also PRP injections, platelet-rich plasma injections for osteoarthritis. It could be tried first. And of course, a lot of vets do that. A lot of sports doctors do that for the athletes. The Pirates, the Penguins, and the Steelers in my area have all heard about PRP. And because it's using your own platelet-rich factors to try to reduce inflammation in your joints. It's not a regenerative therapy like stem cells, but it's a very good therapy. I use it every surgery day in my practice. Every Tuesday and Friday, I'm doing PRP on animals, and usually stem cells too. But PRP is on animals because not all of them are candidates for stem cells. So we can still use PRP. We can even use it on bad back dogs, which is pretty neat. So
Okay,
long answer.
That's okay. We've hit the hour mark, but I have one quick question for you here. How do I remove mucus from my cat's nose? I would say carefully. or not at all, but you're the vet.
Yeah, I would say warm water cotton ball, maybe, and or Kleenex to try. You're not asking them to blow their nose; you're just trying to wipe it away. Some people have some success with bulb, not syringes, but bulbs. You've seen them in little children. You sell them in the stores, and small ones that you can squeeze, put up their nose, and let it out, and that usually doesn't irritate cats a whole lot. But well, everything irritates cats. So.
You took the words right out
Yeah,
of my mouth.
who am I kidding? And but so that you don't get hurt, and it makes it more secure for them. Sometimes wrapping them up in a towel, getting their feet in that towel, will make it easier for you. If it's something that you had to do routinely, I would suggest that you get one of those zip up covers that you can put around the cats, where only their head is out, where you only have to watch out for the fangs. And so, but be careful, and I'm not sure I would enjoy that process. I'd be able to wipe my cat's nose, but it's so Kleenex, warm cotton ball soaked in warm water. And when I say warm cotton ball soaked in warm water is another good one too. But thank you for all for watching. Have a blessed Easter. Happy Easter. It's tomorrow, and thank you for tuning in. And remember, don't just live and let live, but live and help live.
And for people who are asking questions, how do I get a question to Dr. Mike? You can email me. My email is wbrbrock@gmail.com, wbrbrock.gmail.com. We're trying to we try to get as many as we can in. So the longer the email, we try to keep as much as you can and as concise as you can, because if they're too long, they're just hard to read, to follow for you, to read for me. So quick questions are the best kind of questions to put through to us. But Mike, have a nice Easter, and I will talk to you next week.
Same to you. Thank you.
Okay. Thanks, everybody.